HBV, we talked about this a little bit during the orientation, the hepatitis B virus. Now, hepatitis B is worse in some ways and not in others. Now, it's hepatitis beta. And there is actually a hepatitis A, hepatitis B, hepatitis C, gamma, all these different versions of hepatitis. Hepatitis, the word itself means that it attacks your liver and your kidneys, okay? Your hepatic system. What's so bad about hepatitis B? Well, it stays alive in dry blood for 2 weeks. Ultraviolet sunlight doesn't kill it. If there was dry blood on that table and I didn't clean it up and came back and you came in contact with it, you could get hepatitis B from it if it was in the blood. Okay? So it was a booger. The biggest issue that happened a while back, I don't know if I mentioned this during the orientation, was surgeons in California, Nevada. They were going to surgery, and this is how doctors were a lot of times. They'd go to surgery, they would perform the surgery, and blood would be on the floor, and they'd be walking through it, and it'd be on the cuffs of their scrubs. And instead of going into the locker area and totally changing and showering, they would rush out, leaving their scrubs on. And they'd go home, and the blood would fleck off into the carpet, and babies were contracting it. There was a lot of babies that were catching it that were physicians' children because of the blood fleck that was happening in the carpet. It started a big new push to get everybody immunized, and now all of you in Alabama, when you're born, you go through a 3-shot series, and you get the hepatitis B vaccine. Me, I didn't have it. I had to go back and get the 3-shot series when I was older. And as I told you during the orientation, if you want to go to a high school that's a public school, Ashley, come back to us. You've got to get the shot series on your own. We can't require it. It's public school. But if you want to go work for East Alabama Medical Center, they can say, we will not hire you until you have the shot series completed. If you want to go to school at CVCC for the nursing program, they can say you're not accepted to the school officially until you complete that shot series. But as I said, most of you all received it if you were born in Alabama. The state does have mandatory vaccination for babies. Well, I think the mother can still opt out if they want to, but hardly ever is that the case. And hepatitis B. What is it going to do? And a lot of times it will not kill you like HIV. Hepatitis B is going to make you very sick later in life. You'll have problems with jaundice and digesting the food. You'll have jaundice as a buildup of bilirubin in your bloodstream, so you'll appear yellow looking. You have to go. There are full-grown adults that have to go to tanning beds. They have to, because they have to go in there and sit for a certain amount of time to burn off the bilirubin excess in your bloodstream. They don't go and tan. They go there to take care of it. You've seen the babies that are underneath the lights in the hospital? You ever gone to the nursery? Seen that? They put them under those lights because it helps to reduce the amount of bilirubin, because they're jaundiced, they're turning yellow because of too much bilirubin in the bloodstream. It's a chemical. So it's something that helps you with digestion. But it probably will not take your life unless you're very, very sick already, very, very young, or very, very old. If you're the average healthy individual and you catch hepatitis B, you're probably going to live a long, fruitful life. You may have some little complications and illness, along the way, but it's not going to do a whole bunch of really bad stuff to you unless you have some other existing health issues, especially with your liver and kidneys. Okay. There is a vaccine for it. Get vaccinated, and the vaccine itself, depending on who makes it and who produces it, you're looking at over 90% success on the vaccine. But again, remember too, nobody is going to come out and say that something's 100% effective. They're asking for a lawsuit. Because as soon as you catch it, you're going to sue them because they said their test of their vaccine was 100% accurate. So no company's going to come out and say that. Okay? But some of them are still extremely effective. Because you got human error, you got injecting in the wrong area, and the body doesn't take it up. There's all sorts of things that can happen. TB, we thought we had eliminated tuberculosis. We thought. Of course, it was still in other countries. Then lo and behold, it wound up rearing its ugly head again from the Orient. And now it started showing up in the U.S. again. So even this one now, they're going to make sure that you have a TB test to find out if you have tuberculosis before accepting you into some healthcare program. You just get the little skin test, TB skin test. They prick your skin. They give you the bad news of it. You know, they're looking for a reaction from the prick. If you react a little bit, it could be TB. If you react a lot, it could be HIV or TB or allergies. So then they do further testing. So if your arm breaks out in these giant whelps, you know, and it's really huge, you've got a ring all around the TB test that's a 1 inch in size, they're going to send you for further testing. If you react just a little bit, you could be pre-screened for TB. You don't react at all, you don't have any signs of TB or any of those things. Okay? But tuberculosis, it's predominantly a lung-based disease. It causes problems later on in life with emphysema and breathing and other types of issues. Pleurisy, you don't have enough fluid in between your lung sacs and the pericardial sac. So your lungs scrape against the side of the inside wall and it hurts. But all sorts of things with that. All right. Purified protein derivative, PPD. Okay. This again is looking at your MMRs, your measles, mumps, and rubella, and those other types of things for vaccination. And this is the purified protein derivative that they're looking for, or they're vaccinating you against for those illnesses, measles, mumps, and rubella. Now, ANSI. ANSI is a federal organization called the American National Standards Institute. They set and maintain all the standards for everything. Okay? Have you got a scale at home? You ever wondered where the true 10-pound weight is? To test that scale to make sure it reads 10 pounds? Sealed in a vacuum sealed vault. It's the scale, it's the weight that they use to set all of the scales that are sold on the market. So that scale, 10 pound, is sent to a company that makes scales. They duplicate it from that copy and then continue to use it to check their scales. And every so often they have to check it with the original to make sure that it's set. Time standards. Standards for that shower that you got to stand in that must give you doused water for 15 minutes. That is set by the American National Standards Institute. Okay? CDC, what are they? Y'all heard of them before? Center for Disease Control. It's where in Atlanta they were so concerned about people that did come over here for the Ebola virus.
What the Emory Hospital?
It's over there by Emory in Atlanta. Actually, it's more south than Emory. But they came into Emory's facility. And everybody's so afraid because Ebola is coming into the United States. You know it was already here. It's already in one of the labs of the CDC contained. It had been in Atlanta already before those people arrived. But you know how they got death threats, they got all sorts of things because of bringing Ebola into the U.S. But it was already here. Just not patient. HICFA. HICFA stands for Healthcare Financing Administration. This is an organization that monitors the employees and the way that those employees are paid and patients are billed in the healthcare setting. So they actually have a lot of control. Doctors really listen to them because that's who's paying for their boat and their car. When you start tampering with some of these clinics' money, they really stand up and take attention. Pay attention. But HCFA, even you, when I send you into a clinic, I have to prepare a HCFA file of your information because you have to be identified as an observation clinical student. If not, then that company has to vouch for you and has to take care of everything about you because of HCFA saying, well, no, if they're not a clinical observation student, they must be an employee. Do you have them insured? Are they covered? Have they gone through all the orientations? Da, 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 da. And if they don't, they get sued by HCFA. But when we identify you as a clinical observation student and have that file prepared for them, then they are covered by it. JCO. JCO. It stands for Joint Commission. Joint Commission. The Joint Commission is the organization that goes and evaluates everything at a particular hospital. They evaluate to see if they're in compliance with HCFA. They evaluate to see if they're in compliance with the CDC, with OSHA, with ANSI, all of them. So, you know, your dad, when they hear the Joint Commission is coming by, everybody's on pins and needles because they know they're about to be evaluated. And they're all walking the line, talking the talk, got to have these certain forms that they make sure that they say the right thing because the Joint Commission is coming in to evaluate that hospital. And they're an outside organization coming to do that evaluation. This is what it became for a little while, the Joint Commission on Accreditation of Healthcare Organizations, and it was too long and everybody kind of fell away from it, and it's sort of gone back to JCO now, but realize these are both the same thing. This was just the old name, this was the new name with all the things. And you know, right now the school is going through accreditation for itself. And it has an organization that's coming in to check us to make sure we're doing what we should to be an accredited high school. Well, this is the hospital's agency that comes in and checks them for accreditation. Here's the biggies. OSHA, Occupational Safety and Health Administration, government agency that oversees all the safety features of all employees, not just healthcare. They're the ones that tell Walmart workers that they got to wear a safety belt if they're going to be lifting something heavy. They're the ones that say that you got to have a harness on if you work at Lowe's and you're going to go up on a big stair or a big forklift and have to get something off a high shelf. You got to have the harness on. But they're also the ones that in the healthcare industry say that you got to keep your employees safe by giving them constant information about what they're catching. CLIA 88, Clinical Laboratory Improvement Act of 1988. I was in the healthcare field when this took place. Back in the day, a doctor could hire a man or a woman off the street, straight out of high school, train them how to do some testing in a lab in their clinic, and they could charge for those tests. Well, what was happening? Because these people weren't very highly trained, there was a lot of false testing. And insurance companies didn't like that because they were paying a bill, a high bill, for your strep test that was being done by somebody who was not competent to do the test, and there was a lot of false positives, false negatives. So President Reagan, working with our Congress and Senate, House Representatives, all those, which one is the same, but got together and created this act that said, okay, if a doctor's going to have a lab in his clinic, he's going to have to hire trained technicians to do the test. And if he does these higher level tests, he's going to have a pathologist, a doctor, to oversee it, the technicians. So that's what the Clinical Laboratory Improvement Act. It also makes it so we have to have that safety manual in there. Because of having a lab, we have to make sure our employees are safe in our lab also, and our students. Okay? Is that it? No, over. Omnibus Budget Reconciliation Act of 1987. This looked at financing again and budgeting for healthcare facilities. Do you remember how I told you that if you go in the hospital and you have insurance, you'll pay $10 for a Tylenol? And the reason you're paying $10 is because the hospital is using your $10 to help pay for the gunshot victim that comes in the emergency room and has no insurance. Well, this used to be really crazy, the way they could run their budget for the hospital and their healthcare facility. And this act came in and said, no, we're going to control this a little bit. We're going to control your charges, like in the DRGs that we talked about in foundations. We're going to control the way you bill all your patients, and make it so you can't just go crazy and do what you want to in a healthcare setting. Okay? We're going to stop there for today. Go ahead and continue to work on your modules just for a little while. Tie up some loose ends. The bell's going to be ringing. Sorry I went so long for today, but I was trying to catch up from what I missed yesterday. Does anybody have any questions? Why do you think I had you paying so much attention to some of that?
Because it's going to be on a quiz.
Yeah, what else?
It's going to be on a test.
What else?
It's important.
Okay, what else?
Because there's...
Didn't you get a whole bunch of
Seriously.
patho-fizz right there?
Huh?
Yeah.
Wait, what did you just say?
Got a whole bunch of patho-fizz right there.
Oh, yeah.
It's getting you
Yeah,
tired.
HIV.
In the last part, we just got through with all the acronyms for some of the major organizations and pathophysiological problems. And when I made mention of the patho-phys reference, that was related to your patho-phys cards that you have to do for this unit, and 5 for each unit that you have in my class is what we have. Now that number may change over the years of this video production, but right now we're at 5. All right, so you're looking here at the slide of the safety manual, and what we're going to do is we're going to break down all the different sections and parts of the safety manual for you to understand them better. But remember, I have to see evidence where during your own time you've gone in and read the safety manual, each section. When you complete a section, it actually has a signing page at the end of that section so that you can document that you finished and the date that you finished that particular section. The first section is the hazard communication plan. Of course, the hazard communication plan, what does it do? It identifies the hazards that we have in our facility. So what are the things that are hazardous, and what are the ANSI standards that relate to each of those hazards, and to our equipment that we have, whether it be personal protective equipment, PPEs that you'll learn about later, and other types of things. So the hazard communication plan or program you'll see in the book is HC or HCP. Okay. The next section is the chemical hygiene plan. This is where we identify and talk about our laboratory chemicals that we use, whether it be anything from alcohol up to gram stains or anything that we might use in the laboratory. The other thing this relates to is CLIA 88, Clinical Laboratory Improvement Act of 1988, that we'll talk about in class, or that we already have talked about in class when we talked about OBRA and other things, which has us regulate how we operate our clinical facility. Next is our infection control plan. What do we do if something happens? Well, first of all, we plan to prevent it from happening in the first place. But then should it happen, what do we do to correct this or make things right? The first part, the BBPS, is the bloodborne pathogen standard, how we look at all the different bloodborne pathogens. In this module, you know that you have to read the Eagle Associates pamphlet on bloodborne pathogens and take the test at the end, making an 80 percentile or better on that test. It's not something that's generated by me, it's generated by Eagle Associates, and it's a good little pamphlet to prepare you for bloodborne pathogens. This is also where we recognize and talk about all of our employees and students having the proper vaccinations for hepatitis B and for their PPD and all that other kind of stuff that they're supposed to have in the way of vaccines for the facility. And then the last part is the PPEs that I mentioned, the personal protective equipment. You're going to have to familiarize yourself with each one of the personal protective equipment that we use here in the lab and others that maybe we don't have. There's a great video for you to watch that we made a long time ago called "I'm Too Sexy for My PPEs," and it's a good one to help you with identifying those personal protective equipment. Also remember that just about every skill is on a separate skill DVD that we have in the lab, although some of them are being redone and inserted in to this particular video production that we're doing right now, like we did with the fire extinguisher skill that we had a while back. The last part, well, sort of the last part, is the medical waste management program or plan. How we handle our medical waste. All facilities have to have a plan in place for how they handle that medical waste that they produce. Remember that it's not considered biohazardous until it comes in contact with warm bodily fluids. The Medical Waste Tracking Act came out several years ago, and what it did was it made clinics and hospitals accountable for the medical waste that they were producing. And basically what this act says is the generator is always liable. If you made it, you're responsible for it. So, for example, if a facility, the story that I tell them in class is about one particular doctor's office where a nurse said, "Oh, I'll take care of all the medical waste. Don't worry about it." She was taking it home and she was burying it in her backyard. Lo and behold, little kids that were kept cutting through her yard on bicycles. One fell and received several needle sticks as he hit a muddy patch of ground that had needles and other stuff that were buried underneath it. Now this is a horrific case, but you know there are situations where that happens. I also can remember when I went to talk to some of the local TV channels about the drug issues that were going on in Columbus, and I said, if you want to find all the drug users at any given time, all you need to do is hang out by the trash cans of doctors' offices, because doctors were not regulated on what they did with their sharps biohazards or their soft good biohazards, and IV drug users would go and dig stuff out of the trash can and reuse it, clean it up a little bit, some not even do that much, and reuse those needles. And it started a big expose, and next thing I know, the guy I was talking to, Chuck Leonard over at the TV station, I think it was Chuck, it might have been another guy with TV, Channel 9 over in Columbus, dropped the story because he was getting too much pressure from his editor to continue on with it. So something to think about. So any questions about the first slide and talking about the safety manual, just remember that a organization, clinic, is supposed to have this manual for all its employees to read, familiarize themselves with, and attempt to keep them from getting safe. And then should something happen, what do they do? Now I said that may be the last portion of it, the Medical Waste Tracking Act. Do notice that there's a section in there for logging our medical waste and what we do with it, and you're going to do with our medical waste. And you may have to have the responsibility of doing a laboratory check where you go through and check the countertops, check the sundry dishes, check the equipment for hazards or problems or mechanical defects. But you also are supposed to check the biohazard containers and make sure they're not full. And then I take you through the process of what we do to get rid of and handle our medical waste. And I won't go over those procedures on the video because those procedures do sometimes change because of supporting and sponsoring clinics that take on our medical waste. We don't produce a whole lot, so we have some of our clinical facilities that host us and add it to their medical waste. But there was another story, another situation where doctors were paying a company that came by and took care of their medical waste. It was a reputable company, they thought. They came by in trucks, they all had the right labeling, the right personnel, the personnel were trained. They took off the medical waste and they put it in a landfill somewhere, I can't remember what exact state it was in. But literally, when that company went defunct and they couldn't find the CEO for it, the owner of the company, they found the landfill. And they literally found the records from that company and went back and contacted every physician, every hospital that had contributed to that medical waste, and they had to pick up the responsibility of paying for having that landfill cleaned up and all of those waste products taken care of. So, like I said, you made it, you're responsible for it, according to the medical waste tracking it. And there's all sorts of devices out there now. There's ones that when you put your sharps in it, you add a little bit of water and shake it up and it turns to a concrete block. There's the old ones that used to clip off the needles and they're no longer allowed because all it did was clip off and leave another sharp part. Now basically the standard is with a sharps container, has to be puncture proof, has to be locked to the wall, because even if you have somebody in your clinic that goes in there and starts tampering with the container and gets a needle or gets stuck or gets hurt, you're still responsible for it, not the person that was playing with it. So making sure that you have good sharps containers and good soft good containers too, that keep your patients away from them, have all the proper signage on them, warning people that it is biohazards and they could be dangerous. So the other parts that are in the safety manual you'll find are a section called MSDSs or SDSs, which are safety and data sheets, material safety and data sheets. There'll be a section that explains and diagrams the layout of the lab so we can identify where things are located. And there's also an inventory section where we inventory all the equipment, all the chemicals, and what have you in our facility. That ends the section on the safety manual.